I'd like to thank you all for being here today. Like Dave said, we just want to inform you all how we have community partnerships in the city to improve the health and well-being of our residents. Partners has a number of organizations through the Chenal 25 in the health and human service field, as well as government agencies that also partner with us. We are a 501c3 and a nonprofit organization that we receive most of our funding from the Determination of Needs funds through our local hospitals, which we're so grateful for. By having these funds, we were able to employ 4 full-time employees and 2 part-time employees to help carry out the mission of Partners for a Healthier Community. There isn't one particular office or place for Partners for a Healthier Community. We're lucky to have office space donated through United Neighbors. We have staff that's there. We have staff here in the Government Center building, as well as in Fall River Recreation. Some of the employees housed there, as well as the Fall River School Department. So I am going to turn this over to Dave Weed so he can briefly explain the principles by which we operate and the health challenges that we're all working on collaboratively in our community. Dave?
Thanks, Lisa. Our principles are based on the same principles that the World Health Organization uses, that defines health very broadly. As you can see, it includes all these factors: community participation, health care services, which is a piece of it, but also safe nonviolent environments, housing, educational opportunities, recreation, healthy workplaces, and accessible transportation, which is why you're here, Bill, because this is all part of creating a healthy community, and that we know that people cannot be healthy in an unhealthy environment. And we'll talk about that in a minute. As soon as I figure out how this thing works, then I guess that's it. You're probably already familiar with the fact that we have many challenges, including poverty, education, housing, substance abuse, a number of chronic illnesses, and the typical causes of those in terms of nutrition, poor nutrition, and lack of physical exercise. All of that should be familiar to everybody in this room already. So what can we do to change all that? Many people think all we need to do is improve access to health care. Send everybody to a doctor and everything's fine, right? But we know that that's not how things work. Well, we should educate the population, make sure that everybody knows how to live a healthy life. Well, we've been doing that for years, and not everybody lives a healthy life. We should improve the environment, make places accessible for walking, more parks, recreation opportunities of that sort, and access to better food and all of that. That's certainly important, but not the whole story. We should change laws and regulations. We're all familiar with the work that Maryland Edge does in terms of tobacco control, and yet we know that we still have one of the highest tobacco rates in the state here. So regulation alone is not the answer. And finally, we can look at engaging everyone in making changes, and we think that's the most powerful tool. Not that we don't want to do all of these things, but the more people get involved in making changes themselves, either within their own family, their own organization, or people who want to engage the entire community, that's the way we can make progress. We start every 5 years with a brand new health assessment. That assessment enables us to understand in great detail the kinds of challenges that we have. We've even put together our own website, Health Data South Coast. You can visit anytime, and you'll find the latest data relative to Fall River. But we include in our surveys not only the information we get from St. Anne's with Tracy and with South Coast Hospital, but also the YRBS in the schools, and surveys that we conduct with people. We do a number of interviews with people. Many of those, 30 of them in fact, are online on our website. Those are interviews from everybody from Dr. Akuri, who's in the ER at St. Anne's and his perspective, to moms at over here Lisa's WIC program. So you've got a good sense of what the health challenges are in the community. We then use that information to develop a plan every 5 years, and we go by the World Population Health Institute and the Robert Wood Johnson Foundation, the largest philanthropic organization in the world devoted exclusively to improving health. We'll tell you more about that in a minute. But they use these 8 categories. That's a way of simply dividing up all the different aspects of health that we need to address. We have put together 62 specific objectives. Those are on our website. First thing, if you go to healthycityfallriver.org, the second menu item down is our objectives. And you can take a look at every one of those. Those are in great detail. A lot of work went into that, and we review those annually and record the progress that we're making with those. One of the things that really brought this city into national prominence, and I don't know how many people are aware, but Fall River was chosen as one of the 6 winners of the first Culture of Health Prize given by the Robert Wood Johnson Foundation. Although they're based in Princeton, they solicited over 200 applications from around the country. And Fall River was included, awarded one of those 6 first prizes. That included cities like New Orleans and Minneapolis. So we were right up there. Cambridge was another one. And then more recently, since they do this every year, we are now among 6 in the Northeast. You can see the list up there. 4 of whom are in Massachusetts now, 3 in addition to us. So we are organizing our first Northeast convention for all of those groups on April 7th. Wendy and I are working on pulling that together. But as a way of exchanging the resources and knowledge that come from the best cities in America, not the healthiest, but the ones who have the best demonstrated work in terms of addressing the health concerns that they have. So we're very proud of that award, and we get probably more recognition outside of Fall River for that than we do here. Not many people pay attention to that. So very quickly, the work we do is all collaborative, okay? And I'll just go through some very quick slides. And we work on tobacco issues, and you're familiar with the work that Marilyn and Dr. Valancourt do. We collaborate on drug and alcohol, and Mike Aguirre, are you in one of those pictures? You should be. At least the kids you were working with are. Right.
I think I saw the mayor in the last one, didn't I?
Well, I was going to put
As a
your
youth.
picture in.
Yeah.
Right. Yeah, there you are, on the left, because you had a lot to do with the tobacco law changes.
You were
there.
another one too.
Yeah, I think the
Right.
one beforehand you were in
Yeah.
as a kid. Right.
As a younger person, I wouldn't call him a kid. And we work on youth violence. We have an annual violence prevention effort that goes on every year, piece by piece. And Wendy's largely responsible for organizing that. We collaborate with organizations in the community, including UMass Dartmouth School of Nursing, the Health First Dental Clinic. We work with Wiggle Kids and all kinds of organizations around here to bring resources to the families who are housed, the homeless families who are housed in motels in Swansea, Somerset, and now into Fall River. Do a lot of work with that and have a full-time person devoted to that. We collaborate to support walking and biking, and many of you have met recently with Julie Kelly and Eric, right? And you'll have more meetings, and there's a meeting for groundwork coming up, and a number of things. But and certainly, Bill, you've been involved with this right along, and this is about making sure that people have alternative transportation other than automobile, and making that easier for people. Marcia's been working with the schools. We are the only school system in the Commonwealth to have had 3 years of 100% participation in walk to school programs. We have 2 schools that do a daily walk to school, safe routes to school program, and we have a number of trainings and things of that sort. And how many thousand kids have been involved?
36,000.
Okay.
That's a lot.
That's a lot. You probably heard something about the fitness challenge. that's us, guys. I know everybody thinks it's recreation. No, it's partners. We pay the person who organizes it, Anne Marie Holly, and we're now in our 9th year, the longest running community-based fitness challenge in America. Okay, Somerset's on our tail. They've done 6 years. We're in nine years. But that's been a fabulous program. It's still going very strong, and we got a lot of participation. And again, Marcia involves how many school students this year?
We've got over 5,000 students who are participating
Right.
in the Great Fall River area.
Who do their own challenge within the schools, separate and above gym classes, or sorry, not physical
Physical
education
education
classes.
classes.
Boy, I'm gonna get slapped for that one. We don't have gym classes,
Gym
we
is
have
a
physical
building, it's not
education.
a subject.
Actually, health and physical education. Another project that we've been working on very strongly over the last 3 or 4 years is education about sugar and making sure that kids and families understand. I see Christian smiling over there. This must be one of your favorite topics there.
Absolutely.
That's also Peter McCarthy with the whipped cream on his face, because we go out to Camp Welch and do all kinds of programs and have a lot of fun with kids there. And the nice thing is that kids and families are getting it. We've seen a big turnaround. People don't buy soda anymore, and now we're telling them fruit juice, as Rose Kudo there from St. Anne's Hospital, instead of holding up a glass of orange juice, which has just as much sugar as Christian's favorite drink. We collaborate on environmental change. Again, Eric and Julie have been working on this with Bill, but all the kinds of changes, everything, from the stairwell gallery, etc. And now in the lower left, the new Quequechan River Rail Trail, which is going to become a signature project for this city. And all kinds of work, you've been talking with Julie about that, is underway. And just
That's
really,
exciting.
really going to
It
change the
It
face of
really
the
is,
city.
yeah.
And we collaborate on Worksite Wellness. We have a full-time person who couldn't be with us here today, Angie Braz, who works not only in Fall River but across the South Coast on communities, employers, both public and private, who want to improve Worksite Wellness. And so you can go to the Worksite Wellness Collaborative webpage, which Partners also underwrites and supports. I don't think there's another collaborative like that anywhere in the Commonwealth, quite frankly. And finally, we collaborate with medical care providers, and we all think, medical providers are always working on health promotion and health prevention. Well, guess what? In the 7-minute appointments, there isn't time for that. So we look at other resources and ways to connect patients with the resources that we have in the community. We do all kinds of things like farmers markets with tokens, and you give out vouchers for vegetables at the markets, etc. We also have 2 major projects. The one that you're working on now with Eric is the $1.72 million Mass in Motion so-called 1422 grant, and then STAR, which started, I think, 2 years ago. Is that right, Mike, with the health integration, the HIT project?
Oh, it was longer than that.
Okay, it goes for 5 years though. So
Yeah.
I think they might be in year 3 or 4, somewhere along the line. But that's to get behavioral health clients connected with health and physical health
I
improvements.
think the last year is this year, though.
Oh, is it? Really?
Yeah.
Okay. So our priorities, you can see them there, and we can, you can go through the list of 62, but primarily tobacco and substance abuse, youth violence, etc., school health, healthy food. Those are the things we're working on. And to conclude, what do we expect from this effort? A continuing improvement, lower crime rate, better parks, cleaner streets, improved education, healthier children, and more productive employees. Anybody against any of those things? Okay. And also a change in the image of Fall River toward a more positive point of view and a higher quality of life. And that real evidence that health behaviors are trending in a positive direction. And a sense that people are turning their lives around, which is, after all, what this effort is all about. So, let's have some discussion in the remaining minutes that we have about what you might be willing and able to help us with.